if the ovulation occurred here on day 14, the egg is going to get to the uterus at about day 20, or 21 or 22. It's plus or minus. And on that day, when the egg gets to the uterus, under the influence of increasing levels of progesterone, the endometrium will have gotten very thick and lush, and the blood vessels will get very twisty, and they will have been giving maximum amount of nourishment to that endometrium. But I said this is a young lady who's not going to get pregnant. No sex, no sperm. There's no sperm hanging around, waiting to cause nothing but trouble. And so, what happens? The unfertilized egg falls into the uterus, and there is no effort of the egg to implant, because only a fertilized egg will attempt to implant into the thick, lush uterus that's just waiting for it. So because there's no implantation, what happens? Well, the follicle keeps making progesterone. These vessels keep getting twistier and twistier and twistier. They get so twisty, in fact, that the resistance to flow gets so high that the blood flow stops. And when the blood flow stops, blood clots. And when the blood clots, there's no more nourishment for the endometrium. So the endometrium dies. Now the myometrium, the muscle, it doesn't like dead stuff. No part of your body likes dead stuff. If there's dead stuff, you try to get rid of it. So the myometrium, the muscle, sees all this dead endometrium and starts to contract, which breaks the dead endometrium loose and sloughs it out as a menstrual flow, which takes 4 to 5 days in this perfectly idealized cycle which I'm describing and which I know no human really has. But this is an idealized, quote unquote, perfect for anatomy and physiology cycle. Okay? So after sloughing the endometrium, we get back to these short little straight arteries. We have a very thin endometrium. All this is sloughed out. Progesterone falls because the follicle just stops making it when the myometrium starts to contract, and we start our cycle over again.